Hello there, I'm David Staples of the Edmonton Journal, and this is the top 10 tweets around the world and in Alberta about the COVID-19 outbreak. I'm here today with Dave Breckenridge, managing editor of the Edmonton Journal. Welcome, Dave.
Thanks, David.
So as part of my work, I'm on Twitter looking for the latest news stories on the outbreak, and I've started to compile all this into kind of a daily story. And based on that, we're going to just go over some of the tweets that you think are really interesting and some of the tweets that I think are interesting. So I'm going to start out with Harvard professor David Sinclair. And his tweet is, "For those who wanted a world without vaccines, witness the world without one vaccine."
Yeah, that's a sentiment I've seen around a lot lately on social media is people saying, look, anti-vaxxers, this is what happens. So
what's yours?
Yeah, my first one here is from a former Post Media colleague of ours, Tristan Hopper. He's now the editor of The Capital out on Vancouver Island. He says, the last 100 years of public health has been geared towards the singular goal of not having politicians cobble together a pandemic response after it was already too late to contain. That makes the events of the last 30 days particularly tragic, since that's basically what happened.
A related tweet. This is from American Lebanese essayist Nassim Nicholas Taleb. And he says, "It's not the reaction that wrecked the economy. It's the lack of initial reaction that wrecked the economy. Proper border controls on January 26, plus masks and tests, and we'd be fine now. The Centers for Disease Control, the WHO, the UK government help spread disinformation." What do you got?
This is a little lighter. This is from Anne Applebaum of The Atlantic. I've always thought the Polish custom of wishing everybody health on all holidays was quaint and archaic. This year it seems exactly right. So I wish all of you health above all. And I can't pronounce Polish, unfortunately, so I'm not going to try. But above all, and happy Easter.
She has the Polish word for good health, I think, there.
Yes, I assume that's what that is.
Okay.
When I grabbed the tweet, I didn't necessarily pay attention to the language lesson I might need to pronounce that last one.
This from Edmonton comedian Andrew Gross, and he's referring to Alberta's chief medical health officer, Dina Hinshaw. "Dr. Hinshaw is like the province's mom." Quote, "No, you can't have friends over. Now go wash up."
Very true. Another lighthearted one I have here is from BC resident Jesse James Richard. "I will be repatriating my father where he will be quarantining on my property, in which I will have full control over his water, electricity, and internet. The tables have turned, Father."
All right. Mine is from Claire Potter. She is co-executive editor for the Public Seminar in New York. And she tweets, "Breaking news. I have been feeling unwell the last 2 days. Tired, headache, foggy brain. I have been concerned about COVID infection, but it was hard to imagine how. We've been so careful." Then she has a PS. "I just discovered 5 minutes ago that I have been making decaf coffee for 2 days."
I feel seen. Not that I've accidentally made decaf coffee, but run down, feel like I just, coffee keeps me in the swing of things amid all this. Next up, I don't necessarily agree with this tweet, but I feel the sentiment. I feel that as best they can, long-term care facilities and assisted living centers are trying their best through all of this. But this is from Alberta resident Kelly at Kelly_T_Mac. Question, what aging senior is ever going to agree to enter an assisted living center after this? What family is ever going to want to place their loved one in long-term care after this? And it is something that I think, speaks to concern that people have about how facilities manage or try to contain any outbreaks in them, especially when you look at Bobcaygeon and Mackenzie Town.
Now we're into the kind of the discussion round, so we'll have a little discussion after each of these last tweets. Mine comes from Toronto, and it's related to what you just said. It's from Toronto Sun columnist Laurie Goldstein, and he links to a Montreal Gazette story, and he tweets, "Jesus, police investigation underway after 31 seniors die at residence in Montreal's West Island, abandoned by staff. at least 5 were COVID-19 patients. So, Dave, I was looking at the numbers today in Alberta. We've had 40 people die from the disease. 25 of them have been over the age of 80, and a good number of those have been from the care home in Calgary. I'm not exactly sure of the number from that particular facility, but it just strikes me, in Alberta at least, this is really wreaking havoc with older people, but not so much with everybody else, except for the economy, of course, except for shutting down everything. And in terms of coming out of that, there's a number of key measures that are going to have to be taken, and Premier Kenney outlined some of them. The massive testing that's going to be going on, the surveillance, probably of electronic surveillance of people in quarantine. But obviously, one of them, to prevent deaths going forward, we're going to need some kind of quarantine for people. Very strict controls, strict quarantines, safety measures in these places where the most vulnerable people in society, health-wise, people who are over 80 and already have conditions, are living. If we want to cut the death rate, that's who this is just cutting a swath through like crazy.
Well, I find it interesting that if you look at the number of cases by age group and then you look at the number of deaths by age group, it feels like it's the children of very elderly people who are getting this, and then I'm not saying that they're infecting all of these other people, but the number of cases in the 40 to 60 age group is fairly high, where the number of deaths in the over 80 age group is very high. And I think that's, it is just an interesting thing about how the people who are getting very sick and dying could very well be the parents of people who are getting sick and not being symptomatic or not have an extreme case of this.
Could well be in that age group, 40 to 60. There's only been one Albertan who's died in that age group, and then one person in their 30s and one person in their 20s, and everyone else, all the other deaths, 38 out of 40 have been 60 and over, and then 25 of them 80 and over. Yeah. So, I do think it's going to be, I think we are flattening the curve in Alberta. The percentage of the increase has been dropping, and it's been really steady. It's been below 10% for some time now. And it was interesting to see Kenney being one of the first premiers to actually talk about, here's the plan for opening up society again. And we'll see how quickly that rolls out. We learn a lot every week about this, and the numbers, it could happen fairly quickly if the numbers stay the way they are and we really do flatten this curve out. It's flattened now in Alberta, and if this keeps up, I think we're going to start to see some opening up of different things. All right, what is your tweet for discussion?
On that note, like one of the my last tweet kind of picks up on where you left off there. It's from Edmonton Journal digital producer and editor Trevor Robb, who's diligently working this long weekend. He was on yesterday when the Premier and our health minister made a significant announcement related to Alberta's response to this. He tweets, Alberta Health Minister Tyler Shandro kicking things off in front of a backdrop of packages. Shandro says Alberta will send PPE supplies, including N95 masks, gloves, goggles, and ventilators to BC, Ontario, and Quebec. Quote, this is the right thing to do, says Shandro. I assure all Albertans that we will have ample supply. This is one of those... I'm glad to see Alberta did this. I know there was talk the other day at the federal level that the Prime Minister was considering invoking the Emergencies Act, which would give the federal government the authority to basically redistribute stockpiles of emergency supplies and resources. And there was concern that he might raid other provinces' stockpiles of these things, namely Alberta, which has done as you wrote the other day, a relatively bang-up job of being prepared and making sure that we had the supplies on hand to manage this. It was funny, though. There's the same people who turned around the other day and warned that the Prime Minister was coming for our goods. Also, now that the provinces said it can help out, has turned around and say, well, what, are we overreacting to this crisis that we just bought too much and there's not the cases to justify this? It's like people just want to find a controversy or a conspiracy here involving our politicians that either, we shut things down too harshly, or that the government botched the shutting down of everything and botched the preparation, and now we're going to go raiding provinces out west for whom there's not a lot of love.
Dave,
But anyway,
if someone's saying that we bought too much and we shouldn't have bought so much, I would say that person should no longer speak in public. Perhaps like take a week off at least. You got time out for a week. Listen,
it's
JP Prasad, the guy who's in charge of purchasing for Alberta Health, he deserves an Order of Canada at this point. I mean, they got intelligence. They were hearing from their contacts in China, people with connections to China, in early December. Something's going on here. There's cases of pneumonia that are really strange in Wuhan. And at that point, they started to double their purchasing orders just quietly. And then they went to their bosses and they said, hey, something's going on here. We need to make a huge order. So before anyone else really was reacting, the WHO only heard about this. The WHO heard about this on December 31st. Alberta, by then, had decided to make this huge order of medical supplies from China. And because we got on this early, we are so well stocked that now when the rest of Canada is in total crisis, we're able to do this. We're able to give it, I think it's like something like more than 7 million masks to the rest of the other provinces who are in need. And that's all because of this guy and his team of people who were on the ball and did this outstanding work. So good for them. And, the one thing I heard was people saying, well, are you sure we should do this? Will we have enough? And I think that at least our leadership on this whole COVID thing has shown itself to be completely trustworthy. So if Dr. Hinshaw and JP Prasad are saying we've got enough stuff to give this donation to Quebec, at least Dr. Hinshaw, then I'll trust them on that they're making this right. And the interesting thing, like, people are dying in these provinces. Like, they are desperate for supplies. This is to me a non-question. We've got to do the right thing here. We're saying who we are right now in this moment of crisis to the rest of the country. We're with our actions, and we've got to do the right thing. And so it's a very simple decision to do it. If you have this huge stockpile, 3-4 months worth of stuff, you can't sit on it. You've got to share it. So good for the Alberta government, and especially good for JP Prasad, who assembled that huge stockpile.
Well, it goes to show that this is what, people have talked about how Canada is broken, especially after the last election. Everyone talked about Canada's broken, Confederation is broken. But this is the kind of thing that proves, like, we are a confederation of provinces that all are trying to work towards a similar goal of a strong nation. And this is the kind of act that shows that people are invested in Canada, and the province of Alberta is invested in Canada. And it can show that, yes, there have been a lot of quibbles, and maybe I'm being a little too idealistic, but it shows in many ways Canada isn't as broken as some people may have wanted to say 6 months ago.
Well, I'd say the provincial response has in many places has not been broken. I won't talk about the federal response, but I think we've done very well. But part of Confederation is this kind of interprovincial play of going back and forth and people working together. So way to go, Jason Kenney, and the Quebec Premier reached out to him and thanked him, right? Like, so for this action. So it was the right thing to do, and it was also a nation building moment.
For sure.
Alrighty. Well, I think we're done with the top 10 tweets, Dave. Thanks for participating today on Easter Sunday, and have a good rest of the day.
You too.
And thanks everybody for listening. Talk to you later.